Hello and welcome to another telehealth information video. My name is Garvin and today's video is on glucosamine and chondroitin. Glucosamine and chondroitin are part of normal cartilage. Cartilage acts as a cushion between the bones in a joint. Glucosamine and chondroitin are two molecules that make up the type of cartilage found within joints. Inside your joints, cartilage undergoes a constant process of breakdown and repair. However, to be properly repaired, the building blocks of cartilage must be present and available. The theory behind using glucosamine and chondroitin joint supplements is that more of the cartilage building blocks will be available for cartilage repair. Glucosamine is a precursor to a molecule called glycosaminoglycan, meaning that glucosamine is eventually converted to this molecule. Glycosaminoglycan is used in the formation and repair of cartilage. Chondroitin is the most abundant glycosaminoglycan in cartilage and is responsible for resiliency of cartilage. Treatment with these joint supplements is based on the theory that oral consumption of glucosamine and chondroitin may increase the rate of formation of new cartilage by providing more of the necessary building blocks. It is believed these supplements may be useful for people with osteoarthritis where there has been breakdown of cartilage. It is thought that taking glucosamine or chondroitin supplements may relieve the pain and prevent or slow the breakdown of cartilage in osteoarthritis. Note, most of the studies have looked only at osteoarthritis of the knee, with very few studies of other joints. To date, there is little evidence that these supplements are effective for any other forms of arthritis. The usual recommended dose is 1,500 mg daily for glucosamine and 800 to 1,000 mg daily of chondroitin. If you decide to supplement with either of these supplements, make sure to follow the manufacturer's instructions. There have not been enough long-term studies to clearly say that glucosamine is safe for developing or nursing babies. Pregnant and breastfeeding women should talk to their doctor before taking glucosamine. Be sure to check with your doctor first before taking glucosamine or chondroitin if you're taking any other medication, as these supplements may cause an unwanted and potentially dangerous reaction when taken with glucosamine or chondroitin. Glucosamine and chondroitin supplements are unlikely to produce side effects. However, there is a small possibility that they will. Some common side effects of these supplements include headache, diarrhea and rashes. So for a complete list of the side effects, go to my website www.lynchespharmacy.com. And remember, all medicines have potential side effects, but this doesn't mean that you'll experience them. That brings this video to an end. If you have any questions, make sure to leave them in the comments below or contact me through lynchespharmacy.com. Thank you for watching. Stay healthy and stay informed.